New cases of COVID-19 are increasing. That's not a surprise to anybody. And while a plurality of these cases are in younger people, our public health experts are increasingly concerned about the virus's spread and the uptick it creates in hospitalizations. Since Labor Day, which was 55 days ago, the number of new cases per day has grown by almost 300%. And over the same period of time, the number of people hospitalized on a daily basis has increased by 145%. Both those trends are obviously heading in the wrong direction. But unlike last spring, we have much better surveillance capabilities, better data, and better ability to prep to deal with what's going forward. That enables us to see where we're going and gives us time to do something about it. And the data points to a clear need to do something about these trends now. What we should not do to deal with these trends is shut down our economy or close our schools to deal with this. Schools are not spreaders, here or anywhere else. It's been proven now over and over and over again by real-life experience and longitudinal studies. And in Massachusetts, the vast majority of employers and employees and customers have done a great job of playing by the rules and limiting transmission. The simple truth is this: too many of us have become complacent in our daily lives. I know it's hard for people to hear me say this time and time again, but it's true. We're doing much better than many other states and many other countries, but here too, we've let down our guard and we have work to do. And that's driving a significant sustained increase in new COVID cases, and that is driving a significant and sustained increase in hospitalizations. If we do nothing and stay on the track we're on now, we'll create capacity problems for our healthcare system by the end of the calendar year. Imagine what that would be like for your friends and neighbors who work in healthcare if cases and hospitalizations continue to rise at double-digit rates straight into and through the holiday season. Double shifts, no time for families, the same urgency and demands on their time that we placed on them last spring. They bailed us out last spring with their grit, creativity, and determination, and they're worried about what they see every single day. They deserve our best efforts to avoid recreating the high case and hospital counts that we all lived through last spring. That would put a serious damper on everyone's holiday season, and especially on theirs and yours. Our healthcare workers in our hospital systems and first responders have all been MVPs throughout this entire pandemic, and they're worried about the trends that they see. You should be too, the people of Massachusetts, because COVID, as we all know, is a relentless, invisible enemy. And the data suggests that if we don't ramp up the fight to disrupt rising trends, we will have a serious problem on our hands in the not too distant future. We have an army of resources and surveillance available to us, like increased testing, a stockpile of ventilators and PPE that can last us through 2021, the ability to quickly stand up field hospitals if we need to, and a robust contact tracing system. And we can continue to be and will be one of the most aggressive testers in the country. And we can continue to identify positive cases and support sick people and their loved ones. We can continue to work and shop safely and enjoy the many places and entertainment venues that operate safely, and we can continue to have our kids go to school. But with all this, state government's ability to stop a pandemic is nothing compared to the power of individual choice. No one's going to do this for us. As the people of Massachusetts have done before, they need to once again participate in the hard work to protect our Commonwealth. That means changing our behavior and putting our guard back where it belongs, which is up. And we have to do it now to slow the spread of COVID and protect our hospital system. Today, we're announcing a series of targeted interventions. First, the Department of Public Health will once again issue a stay-at-home advisory. This time, the advisory will be in effect from 10 p.m. to 5 a.m. Residents should stay home between these hours, with exceptions like going to work or to the grocery store. I've also signed an executive order that will require indoor recreation facilities, theaters, casinos, and virtually anything else that's open that's an entertainment venue to close at 9:30. It will also require restaurants to stop providing table service at 9:30, but they can continue to provide carryout. It will also shut down liquor sales at restaurants and at grocery stores and package stores and convenience stores at 9:30 p.m. We've also updated the gatherings order to reduce the gathering limit of private homes to 10 people for indoor gatherings and 25 people for outdoor gatherings. With limited exceptions, this order also requires that all gatherings inside, outside, and private homes or event venues need to end by 9:30. And finally, I signed an updated face covering order. The new order requires everyone above the age of 5 to wear a face covering in public. We're making this clear for everyone. No more exceptions and no exemptions for when you can maintain social distance. It's our hope that this simpler, more straightforward rule becomes easier for the public to follow and easier for local officials to enforce this mandatory order this way. And these measures will go into effect at 12:01 a.m. on Friday, November 6th. These targeted measures are intended to reduce the number of opportunities and activities where people gather in groups and get them home with only members of their household. The intent is to cut down on the transmission that we all know is occurring in social gatherings. The most effective weapon against this virus, of course, remains personal responsibility. With these measures, it's our hope that we can encourage everyone to act responsibly and stay away from riskier activities, group, social activities, social interactions with people you're just too familiar with. I know there's a lot to keep in mind these days with all the orders that are changing and the states doing different things, but our message here is very simple. We can't afford to continue to do what we've been doing. Whenever possible, avoid gathering, no matter the location, with people outside your household. And when you do go out, wear a mask. And the last part, get tested. We have Stop the Spread testing sites in 18 communities available for free testing with a 2-day turnaround time. Many local communities are running free testing shops alongside or in conjunction with ours. There are many other sites to get tested if you check mass.gov/COVID-19. And when you get tested, you need to quarantine until you get the test results. Think about how far we've come since last spring. We've been able to build a whole bank of resources to fight COVID-19. We've been able to develop and execute a successful reopening for our economy to get people back to work. We've come up with a plan to safely reopen schools, which was endorsed by the Massachusetts version of the American Academy of Pediatrics. Today's proposals represent a targeted intervention that's meant to preserve our progress while correcting the dangerous trends that keep building. We believe that if people increase their vigilance, we have enough information and resources available to fight this virus. We want to do everything in our power to avoid reverting back to phase 1 or phase 2 of our reopening plan. But that requires us all to step up and make some changes. We encourage employers to continue to telework if they can, but young people need to stop having big house parties, and we're planning to talk with local officials about how we can work with them to prevent these events going forward. Folks need to postpone or rethink any indoor get-togethers like big birthday parties, baby showers, or watching football or some other big sports event with your neighbors. These are places where COVID spreads. Unregulated gatherings, even if they're small, where people let down their guard. If you're looking to go out, choose an activity or a place that follows our guidance to stop the spread of COVID-19. Right now, we're requesting that you make real sacrifices to keep our schools open, our economy operating, and our healthcare system functioning fully and without disruption. We also know how difficult this is, how hard the message is, and how unappreciated by many it may be. But it's important that we embrace these changes. We do need to adjust how we live and accept the responsibility that we all have every single day to fight COVID. And if we do it, we can and will stop the spread. How do I know that? I know that because we've done it before. And we can do it again because we know what works. We learned a lot since the beginning of this pandemic 10 months ago. We know schools, even in areas where transmission rates are high, can safely teach kids in person. And we must do everything in our power to ensure that children, especially those coming from families with low income and at-risk communities, have a safe, nurturing place that they can learn. We know that all kinds of businesses that make Massachusetts a great place to live and raise a family can be open to workers and the public with the right steps and rules in place. And we know how to kill this virus. Once again, it's time for the people of Massachusetts to step up for one another, to play by the rules and to fight the fight. But none of this can happen. Open schools, a working economy, safe and responsible recreation, if people ignore the rules that make it possible to stop the spread of the virus. We all need to show it the respect that it demands and to protect and preserve one of the finest healthcare systems you'll find anywhere in the world. It's time once again for us all to do our jobs. And with that, I'll turn it over to the Lieutenant Governor.
Good afternoon. As the Governor mentioned, we have made tremendous progress since the spring to prepare and fight COVID in every community and across our Commonwealth. We went from an average of 2,000 tests per day to 70,000 tests per day now. We built a stockpile of PPE for first responders and medical professionals that is projected to last through 2021. We have secured hundreds of pieces of life-saving equipment like ventilators that can be ushered to our hospitals on demand. We have the ability to stand up field hospitals and increase hospital capacity for COVID patients if necessary. The command center has ramped up contact tracing and the most robust set of public health data in the nation. And today, we're further updating our daily dashboard to offer an updated and more informative package of daily information for the public. Secretary Sudders will talk more about that shortly. But the recent data and surveillance are suggesting that trends for new cases and hospitalizations are going in the wrong direction. We must stop that from happening by acting now. As co-chair of the reopening committee, I know how hard the business community has worked to safely reopen. Businesses have made incredible sacrifices during this pandemic and have done a great job operating by new guidance safely. Restaurants continue to do a good job of being creative and innovative and serving their customers and adhering to safety protocols and operating procedures. And as a result of these efforts, the public health data indicates that restaurants are not linked to COVID outbreaks. As the Governor said, these targeted measures are intended to reduce activities where people gather in groups and get them home for the 10 p.m. stay-at-home advisory, with only members of their household. Today's announcement is a strategic and targeted intervention to disrupt rising trends. We are urging the public to take this seriously and to follow the new stay-at-home advisory, updated mask order, and gathering limits. We want to keep our economy open and our schools open, rather than go back to phase 1 or phase 2. The Commonwealth can only be successful with the compliance of every resident. Please do your part to wear a mask, social distance, and adhere to the stay-at-home advisory so that we can keep our communities healthy and keep our economy open and operating. I'd like to now turn it over to Secretary Sudders.
Governor, Lieutenant Governor, good afternoon. Massachusetts produces one of the most comprehensive public data reports on COVID in the nation. We provide detailed municipal level data, college and university testing data, contact tracing information, and hospital level information. Last week, Massachusetts joined only a handful of other states to report on case clusters. As our understanding of the pandemic in the state has evolved, certain data metrics become more useful and other metrics less so when seeking to understand the current impact of COVID on our state. To continue to provide information for the public's understanding of the current and cumulative impact of the pandemic, We have reorganized the daily dashboard to better reflect the key data most important for understanding and planning. Starting today, the dashboard includes both new data points and is reorganized in order to help the public more easily consume the growing body of COVID information as we work towards a highly interactive digital dashboard to be launched early in the new year. We will be adding a new category of information, case growth by age group, which helps to contextualize the impact of COVID in the Commonwealth. As we've seen, people testing positive for COVID is a much younger population compared to April. As we've been saying, now about half of all cases are people younger than 39. We will also report on the effect of university testing on our daily numbers to provide greater clarity on how this testing impacts the Commonwealth's overall testing and case numbers. When it comes to testing, hospitalization and other data will be presented in two ways. You will be able to view the trend going all the way back to March, and you could focus on the trend for just over the past 6 weeks. We know that many, including researchers, academic institutions, municipalities, and others, look to our state data to create their own reports for their own audiences. All of you who consult our data reports are used to seeing our data in a certain format. While we have made format changes to the way the information is presented, all of the raw data files will continue to be posted on a daily basis, so you're able to access the data for your own purposes. The weekly report will also be formatted differently. The dashboard will now be posted at 5 p.m. every day. One other update, and that is regard to contact tracing. This morning, we have authorized an additional 305 new hires for the Community Tracing Collaborative, with a priority on language other than English proficiency. The Contact Tracing Collaborative already has 671 employees with an authorized hiring up to 768. So with today's authorization, they will be increasing up to just over 1,070 staff. These additional employees will support contact tracing and support the efforts of local boards of health. Early in the spring, the CTC managed approximately 30% of all contact tracing on behalf of our municipalities. Given the increased numbers and positive cases and contacts, that has almost doubled in October. We will continue to respond and adapt as we manage our way through the pandemic. Governor?
Questions?
Governor, can you explain how the state can enforce the stay-at-home advisory, and also can you explain your thinking about alcohol sales and setting that up at 9:30?
Well, first of all, what we were looking to do here was three things. First of all, send a message about the importance of being home at a reasonable hour with the people you live with. That's goal number one. I mean, anybody who spent any time on social media this past weekend following sort of the activities of all those involved in Halloween would discover that while there was a lot of stuff on social media about people trick-or-treating outside and doing what I would describe as the safe thing, there are also just hundreds and hundreds of pictures of parties that went on way into the night where no one was social distancing, where people were piled all over and on top of each other. And it looked really fun, don't get me wrong, but I can't think of a worse way to battle and fight the rise in COVID cases than that. So point number one is we'd really like people to be home by 10 o'clock with the people they live with. That's number one. Number two, by making a decision, and it was a difficult one, to say that virtually all of the entities in Massachusetts that are typically open late at night need to close at 9:30 so that their customers will have the opportunity to get home by 10 o'clock. Now, we included in that the restaurants can continue to do takeout, but obviously if there's a stay-at-home advisory in place until 10 o'clock, the amount of takeout they'll be able to do is fairly limited. But we felt it was important to create some distance between the time of closure and an opportunity for people to get home. And number three was to make very clear that limited gathering sizes indoors, 10 or less, combined with a 10 o'clock stay-at-home advisory would give landlords and building supers and condo owners and a whole bunch of other people, including local law enforcement, or some of the folks that communities are using generally that aren't law enforcement to break up big events, the ability to use that order and use that advisory and the gathering order to say, you folks are out beyond the time of the gathering order, out beyond the time of the stay-at-home advisory, you have more than 10 people here, folks need to go home. And do I expect everybody to follow these rules? No. But if there's one thing I've learned since the beginning of this, it's the vast majority of people in Massachusetts are rule followers, and if you give them rules and guidance, they will do it. I mean, I remember standing in front of all of you when we put our travel advisory in place, and there was a tremendous amount of skepticism about our ability to enforce that. And I stopped counting how many people from around the country who came to Massachusetts did our travel advisory when the number got above about 200,000. Most people will follow the rules if you give them a reason and a rationale and a program with which to follow the rules. And we expect most people will follow these rules.
But to be clear, this is a request. This is an advisory. This is not a mandate.
It's a stay-at-home advisory, similar to the one we issued, by the way, last spring, which the vast majority of people in Massachusetts signed up for. Similar to the advisory we issued with respect to masks last spring, which the vast majority of people in Massachusetts signed up for.
Governor, how long do you feel this is going to last? In the spring, you wanted to flatten the curve. Now, how long do you think this advisory will be in effect?
Well, this is the same game. I mean, if you look at our data over the last 2 months, we're up 300% on daily new cases, and we're up 145% on daily COVID inpatient hospital counts. The game here is the same, which is to bend the trend.
Governor, what would you say to restaurants who say that by closing at 9:30 or any additional restrictions, you might be causing people to congregate with people that like different households?
Well, we're telling people to go home. We're not telling them to go to their friend's house or their neighbor's house or somebody else. We're telling them to go home. And with respect to sort of picking a time and choosing how to do this, I think from our point of view, 10 to 5 seemed to us to be reasonable and responsible and doable and explainable. And those items had a lot to do with why we picked that time. Now, with respect to why certain places need to close by 9:30, if they don't close by 9:30, the people who are there will never be able to get home by 10. So the goal here is to give people time to get home and to give responsible business operators the ability to recognize when they need to start sort of not taking any more reservations and presuming people can leave.
Does the mask requirement apply to high school sports, soccer players, field hockey players? Are we going to see them out on the field with masks?
You'll hear a lot more about us from us on this by the end of the week.
Governor, how does the mask order is that guidance versus an order versus something that's a little stronger than what it was before? Do you elaborate on what's changed?
I would say that the mask order remains what I would describe as guidance, but the difference here is we're eliminating the 6-foot spread. We're basically saying if you go out in public, wear a mask.
Governor, do you foresee us eventually reverting back to an earlier phase? And if so, what exactly would it take for that to happen?
I said in my remarks that schools need to stay open, and that's not just true here. I mean, you look around the world, everybody's concluded that closing schools last spring was probably a bad idea, okay? And the basic message that's coming out from most people this time is schools aren't spreaders, and it's hugely important for the educational and social development of kids and the psychological development of kids that they be in school. With respect to the work-related piece, our view was our problem are informal gatherings with people you know in which people don't take precautions. And the best way to deal with that was to create a message that says we want you home with the people you live with by 10 o'clock.
Governor, how are homeless people expected to abide by this, the curfew and the advisory? Are there any changes or any plans to ramp back up any resources for people who might not be able to be inside by 10?
Well, we have a long series of conversations that have been going on for a while with folks in the shelter community, and obviously our goal is to make sure homeless populations, especially as the weather gets colder, have a place to go.
Governor,
what about 24-hour businesses like gas stations, pharmacies, things like that? Will those shut down?
The whole list will be available on the on the state website later today. Obviously, it doesn't take place till Friday. People have some time to plan in advance. But the way I've been thinking about it is food and pharmacy are considered to be places where people need to be able to go. If you're going to and from work, you should be able to go to and from work as well. But the details will be on the website later today.
Can you speak to the National Guard activation and why you chose to do that for Election Day?
Yeah, so we've made a habit over the course of the past 4 years to call on the Guard when our colleagues in local government ask us to do so. Sometimes it's on very short notice, sometimes it's in advance of a storm or something else, or sometimes it's in response to a fire. And we've also brought them out when local communities have raised concerns about their ability to safely manage really large outdoor gatherings. And we've heard from a number of our colleagues in local government who've asked us to make the Guard available if need be, sort of later in the week. And but the goal here is to basically be supportive of local communities.
Governor, there's been an outbreak of cases at MCI Norfolk. Are there any plans to have policy changes to visitation? And also, are you considering requiring that employees test before they go on campus?
So it's my understanding that we're testing pretty much everybody at Norfolk today, aren't we?
Staff?
We're starting today.
Staff included?
Everybody. And if staff don't, and if a staff member doesn't want to get tested, we're going to tell them not to come to work. Okay? But that's how we're going to test everybody.
Governor, how long will you be monitoring to see whether these new restrictions reverse the trends before considering new restrictions?
Well, obviously, we've got to wait some period of time. And generally speaking, the window most people typically talk about is 2 to 4 weeks. And we've historically talked about 3 weeks worth of data reporting, which is typically 4 weeks. So I would, the shorthand answer to that would be, figure at least a month.
Governor, these changes are happening, but the dashboard, the yellow and green lights haven't really changed. Testing is still in the green. Transmission, positive tests is also still green. Should people trust that that is an accurate portrayal of what's going on if we're taking on these new restrictions?
That's one of the reasons we're also changing the dashboard. And remember, when we set the dashboard up, part of the reason to redo the dashboard is because many of the goals and objectives of the old dashboard have changed. And the perfect one is testing, right? The whole point behind how we measured testing back in the day was, are we doing more of it? And are we doing more of it in the right places? When we first started creating that dashboard, we were doing about 5,000 tests a day. And I remember people saying, how many tests do you think you're going to be doing by the fall? And we said 50,000. And honestly, there was a fair amount of skepticism about whether we could do 50,000 tests a day. So the measure on the testing piece was driven as much by, are we getting to the goals that we believe we need to get to create surveillance with respect to our testing? Are we making it available to people who need it in a reasonable period of time? What's your turnaround time? Our turnaround time when we put that metric in place was 3 to 5 days. Now it's 2. So part of the goal here is to not only update around the things we think are important, but also to recognize that how we were defining how we were doing in the spring was different than the way we define it now.
Governor, what's your message for people with Thanksgiving coming up when you mentioned the 2 to 3 week time frame that puts you right at Thanksgiving, so people are making plans now? There are some people who have fairly large families, and it's going to be difficult for them to live up to some of those numbers, I think. Maybe 25 might be for some families tough. But what would be your message for people as they're looking at Thanksgiving and then Christmas right behind it?
Well, I guess what I would say about Thanksgiving is if you live in a household with more than 10 people, that's your household, right? Fine. But I would say that people should limit their Thanksgiving to 10 if they're involving a lot of people from the outside who they don't normally spend a lot of time with. And we talked about this last week and said that we felt people really ought to keep in mind that a day-long event with a lot of eating and drinking and a lot of close contact and hanging around, if it's with a whole bunch indoors with a whole bunch of people you don't regularly spend time with, is really a perfect recipe for COVID to spread, and that we would recommend against doing that. And I get asked what we're doing, and I said it's basically core family, and that's it.
Governor,
the exact number in Massachusetts, but I think the mortality rate for COVID is pretty consistent from place to place. And the big issue with COVID, while it's awful and terrible, and always will be, that a significant number of people have passed away, 220,000 plus in the US and over 1 million worldwide. The thing that makes COVID particularly dangerous is the speed with which it moves from person to person to person. And that's what today's announcement is really about. We will continue to have to fight the fight around both morbidity and mortality. And the fact that COVID's mortality is not that great is really not, in my mind, all that. It's only important in the sense that it means fewer people who get it will risk death. But the bottom line is this thing spreads like that if you give it the opportunity, and it's the number of people it infects and the incredible unpredictability about how that infection will affect different people that creates a huge part of the challenge for the healthcare community and for society generally.
What are you hearing from the healthcare community, particularly when they look towards another surge?
Well, what the healthcare folks have said to us is the rise in cases with younger people, is a less risky trend for providing healthcare than the rise among older people was in the spring. But they've also made pretty clear to us that the rise in hospitalizations generally is a concern to them. And they were the ones we worked with to scenario plan around when we would get to the point where they really had some legitimate concerns about their ability to both serve COVID folks and take care of everybody else. And they said if that trend were to continue for the next 8 or 10 weeks, it could create real problems for them, and thereby creating real problems for all of us.
Governor, you talk a lot about social gatherings as the place where this spread occurs, but the cluster data that you released last week was not very convincing on that issue per se. Maybe it's on reading the wrong categories or different, but what's your basis? Anecdotally, it seems like you're right, but what's your basis for concluding based on the data you see?
Well, first of all, anecdotally, that is where most of the stories come from. And secondly, if you talk to folks in local government, if you talk to local boards of health, if you talk to most of the folks in the healthcare world, they'll tell you that the vast majority of the cases they deal with typically involve what we call social gatherings. But keep in mind that, maybe Mary Lou should speak to this, the social gathering definition that's used by DPH is a very particular and specific narrative or definition that doesn't necessarily apply to a whole bunch of other things that I think most of us would think of. A bunch of people sitting around and watching a football game piled on a couch on a Sunday, I think I would call that a social gathering. It wouldn't meet the test of the folks at DPH.
But that would be in households in your cluster that people are sitting around watching?
More likely there, yeah.
Governor, what exactly is the penalty if someone has a party at like 10:30 or 11 p.m., violating this curfew, violating the gathering restrictions?
Stay-at-home advisory.
Yes, I'm sorry, but what are the penalties?
They're all civil, and they're up to, and local communities can enforce them with whatever means they feel is most appropriate. I mean, in my own perfect world, what they would do is they would take the gathering order and the stay-at-home advisory, and they would use it as a mechanism, just tell everybody to go home. And if that means blaming it on me and on the Commonwealth, I'm all in on that. I think if people violate it on a regular basis or refuse to leave, then the local folks are probably going to have to be a little more aggressive about how they handle it.
Civil meeting fines?
Yeah, exactly.
Governor, are you concerned, tomorrow is election day, and of course there's a lot of talk nationwide about social unrest. With these rising numbers, are you concerned that if we see something here as far as large-scale demonstrations, that it could be a real problem for COVID?
So, maybe the Lieutenant Governor will remember this, I think we had somewhere between 100 and 125 demonstrations in June of more than 100 people, and we had 10 that had more than 1,000, and we had a handful that had more than 5,000. And And we were very concerned about what that might mean with respect to COVID, especially since so many young people were there, and if they lived with a grandmother or a grandfather or something like that. So we did a 3 or 4 day free testing thing for anybody who participated in a demonstration, no questions asked. And it came back with a positive test result that was pretty consistent with where the state was at that time, which is about 1.6%. Now, they were outdoors, they were moving, and almost everybody was wearing a mask. So I guess what I would say is outdoors, moving and wearing a mask, in my view, is a much different kind of event than a big demo that involves no masks, not a lot of movement, a lot of shouting without masks, and indoors. I mean, obviously outdoors would be better in that circumstance, but I really do think people underestimate the importance of this in any kind of large group.
It's something you're concerned about, the possibility, because we are, as you said, in June the numbers were going down, now they're going back.
Yeah, no, I mean, we're hardly the only place where there are issues with respect to rising caseloads. I mean, if you look at Europe, if you look at Canada, Europe, in some cases, more aggressive and faster than even here, and you look at the rest of the U.S., there are very few places in what I would call the Western democracies where people don't have issues with rising cases right now.
Governor, can you point to any evidence that shows that curfew is effective with COVID, or is this just sort of a gut check that you think that
I think part of what, like I said at the beginning, part of this is about messaging that we want you to go home, all right? We don't think shutting down our economy is the right thing to do because we don't think it's in the data. And employers and employees and customers, for the most part, have done most of, I mean, there are exceptions. I mean, the ABCC has probably done more than 10,000 inspections of one kind or another, along with DPL, and has found a few hundred violations along the way. So we don't want, we're not saying don't go to work. We're saying just the opposite. People can continue to work as long as they play by the rules and follow the guidance. Same thing with respect to schools. Schools should stay open. Play by the rules, follow the guidance. The goal here is to say all this stuff that's going on, that's indoors, that's informal, that's not masked, that's close contact, where people are sharing food and drink and a sofa, is just exactly the wrong thing. And it's a big part of why a huge part of the growth in our trend has been young people who fall into that category. And I think what we're trying to say here is by 10 o'clock, people should use their heads and be with the people they live with, instead of continuing to perpetuate this constant churning of folks, especially in informal settings, in places and spaces where there aren't any rules and there isn't any guidance and people aren't adhering to any of the distance or mask rules that are effective at reducing the spread.
Thanks, everyone.
Thanks, folks. If you haven't voted, get out tomorrow.